Today I'll give you all an update on the ongoing COVID-19 response by the Waco-McLennan County Public Health District. The dedicated and professional public health team at the Waco-McLennan County Health District has been actively monitoring the spread of COVID-19 in the community. The epidemiology team at the health district, led by senior epidemiologist Vaccination Shah, have been actively monitoring the spread of COVID-19 in McLennan County. Today, I've invited Vaccination to be here with me in case there's any questions specific to the data. Since April, there has been a drastic increase in the number of COVID-19 cases reported daily. As you can see on this graph, the 7-day running average of the reported COVID-19 cases at the end of April was 31.86, and as of September 3rd, the 7-day running average had increased to 281. Please note some key dates on the graph. On March 2nd, the Texas mask mandate was lifted and businesses were allowed to reopen at 100% capacity. On March 29th, everyone over the age of 16 became eligible to receive vaccines, and local school districts started school in the middle of August, around August 17th-ish. The increase in the case of increases in the cases reported continued throughout the summer between July 1st and September 3rd. There was a 2,082% increase in the number of COVID-19 cases reported in McLennan County. This steady increase was extremely alarming for health district staff and our local health authority, Dr. Farley Verner. As expected, an increased number of cases reported resulted in an increased number of hospitalizations. At the close of April, the 7-day running average of COVID-19 positive patients admitted into the hospital was 15. As of Friday, September 3rd, the 7-day running average had increased to 186. This map shows the hospitalizations based on zip code. The areas with the darkest shades of green saw the highest number of hospitalizations, and these are also the areas with the lowest vaccination rates. Beginning August 23rd, the Heart of Texas Regional Advisory Council began providing data to the health district with the vaccination status of COVID-19 patients hospitalized or on vents. The information provided reinforced the message being promoted by the health district, the Texas Department of State Health Services, and the Centers for Disease Control and Prevention. The COVID-19 vaccine products are safe, effective, and can prevent the spread of disease, hospitalization, and death. As you can see on this slide, and these numbers will be reflected in the email that I send you guys daily, but 95% of the patients that are in the hospital have been unvaccinated, and those that are on vents are 96.5%. This slide just sums up the impact of the Delta variant and what it's done as far as it relates to COVID-19 cases. The steep increases in the cases can be attributed to the highly contagious Delta variant, which is more than 2 times as contagious as previous variants. Dr. Jennifer Schufert, the chief state epidemiologist, reiterates on a weekly basis that 99% of the COVID-19 cases reported to the state can be attributed to this highly contagious Delta variant. Also, data suggests that the Delta variant might cause more severe illness than previous strains in unvaccinated persons, and also all the currently available COVID-19 vaccines are effective against the Delta variant. The spike in COVID-19 cases and hospitalizations was followed by a spike in deaths. In August, there were 66 deaths caused by COVID-19 infection. Since the start of the pandemic, there have been 548 McLennan County residents that have lost their lives to COVID-19, and this data is based on Friday's information, but today our number has increased and there have been 563 deaths attributed to COVID. These deaths are not just numbers, but are indeed mothers, fathers, daughters, sons, friends, co-workers, and loved ones that are no longer with us. Daily, our staff mourn with these families and are hopeful that our vaccine and education efforts can be better received. This map shows fatalities based on zip code, and once again, you can see that those with the darkest shades of green have the highest percentages of fatalities, and these are our areas with the lowest vaccination rates.
LaShonda, this map and the map prior, this is the entire zip code, not just city limits, correct?
Yes, the
Because we
entire
have some zip
code.
codes that
Yeah.
that cross cities. Okay, just want to make sure. Thank you.
Our vaccination efforts continue, and as we saw an increase in cases, we began to see an increase in vaccine uptake. This increase was the result of expanded outreach efforts by our COVID-19 vaccine coordinator, Mr. Pablo Ramos, and includes collaborations and partnerships with churches, local school districts, higher education, and businesses. This map shows the vaccine uptake based on zip code. The areas shaded the darkest shades of green have the highest percentages of people vaccinated, fully vaccinated, and the areas with the lightest shades of green have the lowest vaccine uptake. This is reflective to what we've seen in the hospitalizations and deaths as well. The Health Disparities Grant recently received and the CARES Act Round 4 funding will provide resources needed to do direct and targeted outreach, including media, town halls, focus groups, and collaborative partnership development to increase vaccination rates, specifically in zip codes and census tracts with the lowest rates of uptake, which happen to also be the areas in the county with the highest number of Black and Hispanic residents. The red dots represent the locations that we've had our community-based vaccine clinics. The data is used to drive the clinics, but we have to have locations and partners willing to host us. This is just a summary update about our vaccination clinics. We're still doing more than 10 mobile clinics across the county each week. We have daily requests for vaccine efforts, and we're being able to fill those within 24 to 48 hours. Our strike teams will host the clinics and the PTR for the next 2 weeks, and then the National Guard staff will return. And all 3 of our COVID-19 vaccine products are currently available at the McLennan County Health District. We'll look at some trends and demographics. Before April, the largest percentage of deaths were seen in adults ages 80 and older. If you look at this graph, you can see that since April, we're seeing adults of all ages fallen victim to COVID-19. Adults aged 40 to 70 attributed to the highest percentage of deaths in April. Also, we have to remember that our senior adults were early adopters and uptakers of COVID-19 vaccines, so we're seeing lower rates for them. Prior to April, hospitalizations were mostly prevalent amongst those ages 60 and older. Since April, younger adults are being hospitalized and more frequently. So the blue line shows the hospitalizations before April, and then the red is the percentage since April. So you can see that young adults between the ages of 20 and 50, or I guess 60, are really starting to see an increased amount of hospitalizations. This slide contains demographic information regarding the percentages of cases, hospitalizations, and fatalities since April for Hispanic, white, Black, and other and unknown populations in McLennan County. We still see a large chunk, well, we've seen an increase since April of white residents being disproportionately impacted now at this point by death from COVID-19. And this next slide shows that since April and based on our data, women are more likely to become infected with COVID-19 and hospitalized, but men are the majority of our fatalities. But the numbers are pretty equal. It's not too off balance. This particular slide gives a little bit of a breakdown of ages, and you can see the percent of cases since April, and as well as hospitalizations and fatalities based on age. And it goes as far as to people younger than the age of 1 and as old as 80. As you can see, young adults ages 20 to 59 have had the highest percentage of COVID-19 infections in the county, and those between the ages of 30 and 79 make up the highest percentage of those hospitalized, while adults over the age of 50 continue to be the highest percentage of fatalities. Our testing efforts continue, and we're now hosting community testing in 2 different locations, and it has been being utilized at this point to the max capacity. Davico is the contractor that we're working with. They provide a PCR self-administered shallow nasal swab test, and there is a pretty significant turnaround time of 48 to 72 hours. We're asking people to provide their insurance cards. If they're not insured, they're able to bill the CARES Act funding for these tests, and there's no fee to the city or the health district for these tests. The two locations are the Waco ISD Stadium parking lot and then the McLennan County College parking lot, and those two locations are seeing about 200 to 300 people a day for testing. And we graciously thank both the school district and the McLennan County College for allowing us to use their space and their campuses for these community testings. We continue to work with the school districts to try to provide technical assistance and support to the superintendents and the school nurses. We're available to them pretty much 24 hours a day, 7 days a week. Our epidemiology, Lacey, is constantly on the phone with school nurses and trying to make sure they understand the contact tracing process. We offer COVID-19 vaccine clinics at the school districts, and we've also helped several of the schools access additional rapid tests so they can test their students and staff. An important part of getting ahead of this pandemic is to ensure accurate information and data are available to the community. So what we're doing is running a weekly Sunday paper ad in the Trib to announce upcoming vaccine clinics. We've also listed radio ads for August and September with LA, Power 108, and 94.5 The Beat. We have digital media ads that you may hear via Spotify, Pandora, and other streaming services. And we've continued to expand our vaccine ambassador program. And working with, in conjunction with the Waco Foundation and the Health Response Team, there's a ZOMAD media campaign that's going to use local influencers to try to impact our vaccine uptake. Waco-McLennan County is one of the first communities in Texas to use paid social media influencers to try to move the bar on getting people to get a vaccine. And this campaign complements the work that's been done by the Health District's Vaccine Ambassador Program. All of the social media influencers will be trained as vaccine ambassadors by our health education supervisor, Ashley Williams, and her team. And this approach ensures that the quality of the information and content being developed is actually accurate and in line with public health best practice. So lastly, and in closing, on behalf of myself and the whole health district team, I'd like to thank our city manager, Bradley Ford, our deputy city manager, Deidre Emerson, Mayor Meat, Mayor Pro Tem Stabito, and the entire city council for your support as we continue to work toward stopping the spread of COVID-19 in our community. Your leadership is appreciated and doesn't go unnoticed. Thank you all.
Thank you so much. Any questions for Ms. Mallory?
Thank you for your presentation, but moreover, thank you for your commitment and dedication to this work. We understand it's not easy, and we understand that you all have not stopped. And so just as, you know, you credit us, we can't, I mean, this information can't be presented with the intensity that it deserves without the work that you all, your whole staff has done. I know you're tired, and I know you're worn out, and it's harder and harder each day as you see these numbers. Sitting up here while, you know, as you were sitting down, I looked up and saw your email and literally gasped. So I can imagine what you do when you open your box every day. So just know that we appreciate the work that you all have done from the first day one to today, tomorrow, but we're committed to doing all the work that we can to try to address this and get it under some sort of control. Whatever work, I applaud the efforts with the non-traditional methods to get people to understand and potentially serve as ambassadors for the vaccine. I know the folks in my district that are vaccine ambassadors, I mean, they take it so seriously. And, you know, I got a call from one weekend, Sunday morning actually, well, afternoon right after church, and he was just in tears because, you know, the people who he's been trying to get vaccinated haven't been and are ill. And it's hard because it's like, I'm trying to tell you that, you know, you are COVID positive, you need to go to the hospital because that's how people are dying. You know, we unfortunately buried 2 of my family members on Saturday, same house, non-vaccinated. the people are dying. They've been dying, but they're dying at a faster rate. And we continue to talk about this Delta variant. We haven't seen any other evidences of other variants here yet, have we? Okay, and that's a good thing. But it is in existence, and it's one of those things that if we can't even get in front of this, in the iteration. So I'm glad to see the testing facilities back open. That was important. I am encouraging people who, have access, if you're at your schools for, because I have one in middle school, one in high school, they both have been sent home with a note. So we go up to the nurse's office, sign the paper, yes, you can test them. Because they need to get tested. My husband works in education, so it is cyclical, and the testing is as important as the vaccination. Do we have even though there's uncertainty right now of the guidelines, how the booster is rolling out? Because I know that, it is available for those who, pre-existings. And so am I to assume that the health district is also providing the booster shots for those who qualify? Yes? Isn't that what I read?
At this time, we're offering the third dose for those that are immunocompromised.
Yes, ma'am.
And they'll, they have to attest to meeting one of the conditions.
Yes, ma'am.
And after September 15th, is it 20th?
I thought.
That's when we'll start making plans to offer an additional dose. But we'll wait on guidance from DSHS because we want to make sure that we still have adequate vaccine to get people vaccinated the first time around.
Very good. Very good. Thank you.
Yes, I want to echo my fellow council members' comments about all the good work that the Public Health District is doing. Greatly appreciate it. I feel like just the inclusion of the unvaccinated percentage of the hospitalized and on vents is such a strong factual presentation that really strikes to the heart of the problem. And because those numbers generally, weirdly correspond with the effectiveness of the vaccine. I guess I've got two questions that are pretty brief. The first is, it seems what I've heard from some physician friends is that those who are vaccinated who are hospitalized generally fall into the pretty severely immunocompromised category. Y'all are seeing generally cancer patients, dialysis. What type of, who among the vaccinated are y'all seeing generally hospitalized and or on vents?
So from whatever data we have, I can say yes, that several of our vaccinated individuals who have been in the hospital have some kind of pre-existing conditions. When it comes to severity or if their illness is more severe, I think a physician from one of the hospitals would have better information on that.
Okay.
And if I may really quickly of note, as of today, 94% of patients with COVID-19 in Waco hospitals, again, 94% of those are unvaccinated. So the folks you're talking about even still is somewhere between 5 to 6 people, 5 to 6% of people hospitalized. And that doesn't take away from your question, but.
No, absolutely. And yeah, Mayor, I deeply appreciate that. And then the only other silver lining I see, and I don't mean this as an argument against masks in schools, because I think that children can still spread it, obviously, but it appears we haven't had a single, essentially elementary age child or a child 1 to 9 be hospitalized since April. That's what the numbers appeared to be.
So you can answer more about that, but based on what we understand from our hospitals, when a pediatric patient gets serious, they transfer the patient to a hospital outside McLennan County.
Okay.
That is why we don't have those numbers in our data, because any pediatric patients are sent outside the county.
So not that it's not happening, it's just that
That's
it's not
right.
recorded, essentially. Okay, thank you.
That might be a data point that's worth trying to explore further. I don't know how you obtain the number of individuals from school-age children from McLennan County that are hospitalized, but out in a hospital outside of county. But
wouldn't it be in the same vein that the numbers that we get, they says this is the number and these are the numbers of people who are not McLennan County residents? But I don't know if they separate out in that, so it would say I'm assuming it's Bell County. I'm not a Bell County resident, but I belong to this county.
So that information comes to us from the RAC, and the way it comes, it's not extremely clear on who is where. So we would have to try to obtain that information from RACs that have pediatric hospitals to try to figure out which of our potential residents were hospitalized in other trauma service areas. So it would take a little bit of effort, and just based on the workload of everyone across the state, I don't know how far we would get down the road, but we could definitely look into it.
I hear that and appreciate it. And yeah, if we could look at it, that'd be great. But I totally understand that some of this data is just incredibly difficult to untease and be able to present, because if we're going to present something, it needs to be right. And I know that that's the standard with which you guys carry it. So understood loud and clear.
Thank you.
I'll just 4 quick points. Yeah, I think this council feels a responsibility to make sure that our core responsibility is making sure those 650 beds hold up and staff holds up in this pandemic. I think last year when we were going through this without the vaccine, we had some, I think all of us were very uneasy what's going to happen. So, which is why we had, masks and all the extra precautions. I think at least I breathed a sigh of relief when the vaccine got here. Got the shots as soon as I could, and I thought maybe this is kind of the end of it. We'll see the economy come back to normal. So the second thing I want to say is pretty alarming, these numbers going up, because our vaccinations are under 50%, between 45 and 50, or between 40 and 50 in McLennan County. And to see the whole numbers come up, it's largely the unvaccinated. So if you're thinking about the population that's exposed, it's about half the population. So to see those numbers, I mean, it's very alarming to me. So I still just urge people to get vaccinated. I appreciate the mayor's work on again, we're kind of having this weekly reminder again, and other professionals in the community that have come forward. You, LaShonda, and the city folks. Dr. Holland has come forth with a very compelling a message. Bradley Ford, all the staff here has done a great job. I'm ready for this economy to get back to normal, and everybody get back to normal, because when you're overloading the hospitals with COVID patients, they're not able to do the work that they need to do in the community. The cancer patients, the emergency patients, the elective surgeries, the non-elective surgeries. So again, I think this all comes back to the core of there's a vaccination available. Let's take advantage of it. So, again, that's all I have there, Mayor. Thanks for your work, LaShonda.
I've had the distinct privilege of maybe sitting from a different point of view and working with you, LaShonda, and your team through the health district and strategic communication efforts. And so, you've only been here 5 months, 4 months, 6 months. I'm sure you feel like it's been 6 years. But thank you for the work that you're doing, Betty He is doing. I know Deputy City Manager Emerson and City Manager Ford are heavily involved right now because of our current state. The leadership from Mayor Meek and what he provides, and the hospitals. I mean, it really has taken a community effort to even get to this point. And so I'm even appreciative of our hospitals, our health district, our ISDs, other city governmental entities that have really just rolled up their sleeves and said, what can we do to help? And so thank you. Thank you. And I believe that still our better days are yet to come. So thank you.
Thank you all.
I'm just going to wrap up with a couple comments here. I appreciate this presentation so much, and more than that, I appreciate the work that our health district is doing. As a city department, I couldn't be more proud of our team. To the members of our community, know that this city, this council, this health district, our city staff are doing everything they can to stop the spread of this virus, to keep our community safe, to reduce hospital capacity. I want the City of Waco team to know that I hear and see the work that you're doing. Health District, I see the work you're doing. What you're doing matters. I know you're tired. I know you're burnt out. I know that it's hard, but it matters. In 2 weeks, we got 8,000 more vaccinations in this community. there's a lot of lives that got saved as a result of that 8,000 vaccinations in 2 weeks. And that is the result of your efforts to communicate, to offer free vaccinations, to strategically identify where we can set up these clinics. What you're doing matters, and I see it, and our city sees it. Since the beginning of this, hospital capacity, like Jim said, has been our primary concern. We're taking it incredibly seriously. This report shows the strategic work that we're doing. We're going to continue to do press conferences. We've done several hopefully thoughtful press conferences. We did a video last week. A couple of us just jumped up and did a video that kind of reminded us, it was similar to the winter storm videos that we did to try to disseminate some information. We've overhauled COVIDWaco.com. I think it's looking so much better. I think the data points are so much more relevant for where we are in this stage of the pandemic. And we've kicked up the free testing and are doing the vaccination clinics and all the other work that you're doing, right down to this very presentation. We're running behind today, but it's like we got to get this presentation out because this might be just one more way to communicate to our community of the work that's being done and the state of things right now. And so, again, I'm just going to take a moment to urge anyone who has not received the vaccine to talk to your doctor, ask questions, and make a plan to get vaccinated. If you've been on the fence or have concerns about the safety or side effects, talk to your doctor just like you would any other health-related matters. And if for whatever reason you're going to choose not to get vaccinated, you can help too. You have to respect how contagious this variant is, and you have to adjust behaviors by doing things like wearing masks, social distancing, and avoiding crowds. And I know that's hard to hear, but that is where we are right now based on our hospital capacity. So I celebrate the 8,000 individuals who have been vaccinated in a short period of time. That's something that we need to mark down, but we got a long way to go. We still have, what's the percentage of vaccinated residents at this time? I'm putting you on the spot there.
Right now, we have about 45% of our community fully vaccinated.
So we have a long way to go. 330 trusted McLennan County doctors signed a letter saying that the vaccines are safe, that they work, and it's the best way to keep our residents safe. These are doctors that we've trusted for years, that we go to church with, that we see at the grocery store, that have coached our kids' Little League teams. These are people that we turn to for every other healthcare issue that we face. And so if 330 names are going to go there, I think it's something to weigh heavily. Again, as was mentioned, this is a resilient city, and I know we're going to get through this together. And I thank you for your time today.
Mayor Meek, if I can just add one thing that's happening out in the Mark community today. We had a man pass away from COVID-19 last week, and his family all planned to go get vaccinated at our clinic that we were hosting at Mark High School this afternoon, so they can hopefully stop this from happening to anyone else in their family. So we felt like that was very powerful, and we were happy to be able to provide and offer that service to the family.